Afternoon, ladies and gentlemen. My name is John Ellison. I work at the University of Michigan Medical Center. I had 19 years starting in computing all the way through the upper management here, degree in computer science, went back to law school, and have been doing the contracts for acquisition of software, hardware, and contract labor for the medical system. And usually my hands are in most big deals that go on around here. We could go on to the next. So I was asked to do 20 minutes, and I put some slides together. We're going to go quite fast through them, then we can go back if we need to flip through it. I don't really know a lot of the background of all the participants, so I'm starting with some basic things and get a little more complex. And so I hope it isn't too basic, but we'll see how we go. So the first thing we're talking about is when people are selling software and how a health center would be buying software. And they're going to be usually getting a software license to it. And it either could be a time-based license or perpetual. If the license that's being given from the seller is perpetual, it looks like an asset, and I'll talk about why that's important in a minute. Or it's time-based, that the license is only for 3 years, 5 years, whatever. The other model is a subscription model, which will be important later when we talk about cloud and ASPs and all that, that we would be presenting the seller that you would be subscribing to use of the software for so much time, and it may be used on your property or other property. The next point is free. Often some people think, well, maybe we'll give the software to someone and then we'll charge for services or that. That can get people into trouble with the anti-kickback statute or the STAR clause, because it's could be an unfair incentive from the seller to a medical system under those laws. So people have to be careful about giving software to a medical center thinking that may work better, that it's free. Now, the reason I brought the last point up is operating versus capital. Most big medical centers, especially ours and others, have two budgets, an operating and capital budget. Under the Medicare rules, if a hospital buys things such as an asset, and why I talked about a perpetual license, they can use their capital funding and get better reimbursement from Medicare and Blue Cross Blue Shield. Where if they buy a subscription or a time-based license or something in the cloud, that usually will have to go off their operating budgets, which is where it gets less reimbursement from the Blues or from Medicare, so the hospitals don't want to do that. The next thing about the licenses is when someone's offering the licenses, it's going to be enterprise-wide, or someone may say a site license that can be used unlimited in their corporation or their health center or medical school or by department. Or are we going to count the license? And how are we going to count it? By the population of people using it or on the number of devices that are being utilized. Now, this goes even into mobile. This could be on desktops, laptops, your iPads, whatever. We've seen all these different models. The issues you get into then is, if you're the vendor, how are you going to track that? Are you going to have a counter in the system, or are you going to build it into the software, or are you just going to trust the customer? To the last point, how do we verify the customer's not overusing it? Of course, there's audit clauses and all that, but usually everyone gets very upset, and of course we've had that happen here, where we overuse and now we're in a disagreement with the vendor, and no one wants to be in that position. So it's better if you're the seller to figure out a way of really tracking it ahead of time so everyone is up front and there's not going to be a problem. We'll go to the next one. Now, maintenance. All software, no matter what it is, you have version 1, but then there's going to be version 2 or version 1.3 or whatever. So there's updates, upgrades, and revisions, and those are the three usual magic words in a maintenance contract for software. Often in the subscription model, some buyers want to consider that's included in the price. Others are going to say, oh, we'll pay for the subscription or the license, and the maintenance is separate. Again, the maintenance will come off their operating account. The buying of the software will come off their capital account. Now, back to the rates. I should have even written lower than 15%, but general rule for software, it's 15 to 25%. We've seen as low as 13% if you're going to have a 5-year contract or a 10-year contract. But most places like here are not going to buy a 5-year or 10-year contract because they don't even know the vendor yet. They're going to buy a 3-year contract, maybe even one only. Well, then they're going to charge a higher percent on the maintenance. So, and of course, everything's negotiable and all this. So, a lot of people are going to ask for 25 and settle on 18 or somewhere. Then you have to think about with
John?
the system. Yes.
Hey, this is Brian speaking. Can we make this interactive, or do you want to hold questions to the end?
Well, I can do questions. I understood I was supposed to speak for about 20 minutes, take 10 minutes at the end, but we can do it in between. It's all okay.
Yeah, I'd like to kind of make it a little more interactive, especially with the team. So, if you hadn't noticed yet, some of these applications we have are actually kind of like phone apps.
Yes.
And they would probably more lean towards a kind of a source code license, or basically, I guess it would be a divestiture rather than an object code license. Let me just ask maybe the car seat team for a minute, Team 19. How would you, looking at kind of these options, how would you think that your software app might make it into the marketplace? Because you're not really selling to a hospital, right? You're more consumer-facing operation. Do you understand enough about the license option here, the enterprise-wide versus not?
So I don't know that I understand. Can you hear me?
Yep. Yes.
Okay. I don't know that I understand enough at this point to answer that question.
So let's talk about mobile apps for 1 second. We have seen licensing where someone says, I'm going to sell you an application for the phones, like for the cell phones, even in the hospital here or the medical school, where they still may sell it as a subscription license that you get to use it for 1 year and then it goes away, or you get it permanently once you buy the app. You get version 1 and you pay your money and you get to put it on your phone and you're done. And you may not be entitled to upgrades. You could buy a service to get the upgrades later, or you may not. Now, if it's source code or object code, that could be either way how that goes. We've seen both models of that also.
So I guess with that additional information, I would think of it as something that would really be subscription model but I'd want to really push the need for maintenance, because if we're going to be giving families recall information and being flexible to changes in recommendations, I think that giving them something stale potentially opens us to more liability than this basic concept has in the first place.
So also, if it's a subscription model, most people if they're actually paying money, they're expecting their maintenance to be included. So if they bought it for 1 year, they got version 1. But if you came out with version 2 6 months later, in a subscription base, they usually don't, except if you're in big systems like the hospital. If you're on a more consumer base, they just want that included. They get version 2, it comes through, they pay their second year subscription, they get version 3 or version 3.2 or whatever. Where a new charge might come along is you say your application has module 1, does X. I see car seat, I'm not sure what that is, but say we have trunk car seat or whatever. That's a new module. So you might say you can pay base subscription $10 for the first one. If you want the second module, that'll be a second $5, and now you'll get the maintenance and the updates for all those pieces too.
Yeah, so with that kind of idea, I think you could say, new parent, here's your first car seat selection, but then when you're getting into the market as your child's older and want to think about your booster seat selection, then that could be version or module 2 for the application.
Any more questions?
Yep. Yeah, I think it's a good application. So let me also pull in then Michelle, great response. So who wants to go next, the database team or the Angry Birds for social anxiety team? Let me pick on Joel for a minute here. So Joel, as an aggregator of case data, and John, kind of thinking out loud, putting you on the spot here. Joel's got an app that reads proprietary case records from some electronic medical record and then visualizes them to a journalist. So from a a licensing type of model, what are Joel's options to take his visualization and evidence-based generation tool into the journalism space?
So again, I think you're still even in the. Let me just digress, as I was going to get into this later. In this computing world, everyone has a lot of models and terminology and nuances. They call things the cloud, ASPs, SASs. But in the legal world, that all sort of flushes down to some basic contracts. They don't care so much. So if that journalist application is going to be sold in some way to go out, but it's collecting data back, the question is do we need to collect fees to get this to work, or do we want to collect money for the application, or is it better that we're getting the data back, and that's our quid pro quo, as I should say, that we want the data, so we may give the application away free because we're doing research? Or is it better we still sell the application for $5, $50, whatever it is, and still collect the data? In a further screen down below, we talk about that. I talk about a little about that in the cloud, where the customer usually wants to own their data, but the vendor may want to use that data for research, quality initiatives, whatever they may be, and you just got to make sure all the security stuff you put in your contracts is clean so they don't think you're going to abuse them by having their data and utilizing it.
Okay, thanks. All right, let's go back to your talk then. I might be jumping the gun a little bit.
So the next thing was, depending on the size of the systems, I'm doing the traditional here, these little phone apps might need training, but if you're selling a real application that's going to be implemented somewhere, there may be contract labor involved in both training or assistance to put it in. And on the bigger systems, when we look at the budgets, it's 2/3 labor, 1/3 for the software. And even some small systems need implementation. And if you think you're going to have to travel to these people to do this, you better figure that out so they don't feel like they're burned later, that you want airline tickets and all that, and worked out. And back to training, you need to think about for your system where you're going to do web or classroom-based. Depending on the complexity of the system or how nuanced it's going to be for the customer, you may need the classroom. We're looking at voice recognition stuff here. Even for just the stuff to be done on a telephone with the physicians, the web is just not going to work. We have to sit with them to work through an application like that, even on an iPad, to understand how they're going to do live interactive voice to a computer to make it work right. Next. Let's talk about the cloud for a second. Again, you're back in the subscription model usually here, but I've just done 2 deals where we bought the software, but we're running it off property. But then the data's off property. And getting to the third bullet quickly, the literature that's out there now, which has even gone into the legal world, and I didn't go into the weeds here because I was told to stay high level. If you look in the literature, they're starting to define the cloud in a set of layers. Sometimes some people define it as 3 layers, 5, 7 layers of actually what are you giving these people? Are you giving them the hardware service, the software service, the data service, the backups, the security, the provisioning, the IDs, all that kind of stuff. And you have to think about what are you really doing in the cloud for them or not. Are you doing the whole thing because you don't want a confusion later of what's going on? And then you're going to probably be under scrutiny of audits because you're running data for people, and different regimes have been established in the United States, at least, about what kind of attestation you have about keeping their data secure and what you're going to do with it. And it gets even to the level of the computing site having physical security. I guess I'll stop again if there's more questions. ASP stands for Application Service Provider, where the vendor is providing an application, and it may be from the whole application, meaning they're doing the databases, they're doing all that. Software as a service, as an example, could be they are letting you run the software, but they may not be holding your data. As an example, in this hospital, what we call the price book of the hospital billing for each bed, we run that as an SASS, where they do computational calculations for us for how much we should charge per bed per room, but they don't have any of the U of M's data there about how many patients we have or what kind of beds we have or our provider data. I think it's just running the software. Next question, slide. Often you're asked, if you're a cloud provider, what's going to happen with my data? Are you taking backups of it to make sure they don't lose it? You're giving the data back, we hope, at the end, but that's usually not in the contracts. And because the data is in a database of some form, the customer wants to be able to use that data and have a tool to access it. Even if the contract is ended with your service, you have to always assume you're not going to be there forever. Next one. So the customer usually wants to own the data, but a lot of vendors will say, we want to own the data and do what they want with it, and that gets into all kinds of HIPAA stuff and problems with that. But often the vendor wants to, that has the data, say it's in the cloud, they want to use that data for, say, in a medical setting, quality initiatives, research, or market analysis. The dangers you sometimes get into is, say you're doing a quality initiative with the data where you're not disclosing PHI or something of that nature, but say you studied in a bunch of hospitals, we gave patients blue pills at one hospital and we gave red pills at another hospital. We've collected this data through the application in the cloud. So now the report comes out in the aggregate that states the people that got the red pills died and the people that got the blue pills lived. Well, that hospital probably doesn't want you to air that laundry of the blue pills or the red pills killed people out loud. So people get very nervous about the vendor using the data for quality initiatives, research, or market analysis. So as a seller, I think it's better if you know your regime of what you're going to do and what you're going to use it for than it to be a mystery so the other side doesn't have a danger. Next one. Okay, so now we're talking about security and breaches. So I didn't want to go into a lot of the details about HIPAA and high-tech, but if you're in medical data and it's PHI, you're in HIPAA and high-tech. But even before HIPAA and high-tech came along, before I go into the other ones, there was state laws in all the states that said you're not going to release people's medical record data, skipping HIPAA coming along. Well, HIPAA more so is to find the hospitals and mess them up for disclosing the data on a federal level. And the state law is still for the patients to sue us if we release their data. So if you're going to be working in the cloud or holding this kind of data, you've really got to think about this, because the fines now, if you do a HIPAA violation of the data, are unbelievably huge that are coming through. Similarly, if you're going to be using data like PII, credit card data, or other data about people, that's got its whole other regime. And then if you're going to be doing studies about providers, which I usually mean physicians here, which we've done a lot of initiatives where we're studying physician behaviors or work, even though it's not under HIPAA at all, they don't want their malpractice records out on the web and all that going out either. So the big trend that's just hit us is the encryption. We've done encryption for the laptops, but now under high-tech and HIPAA, if you are working towards encryption of all your machines and all the data and all the mobile devices, when I mean mobile devices, I mean flash drives, CDs, everything are encrypted, then you're in the safe harbor. So you have to think about that. And the way you think about that is it's added to contract schedules of how you're going to do the security and how you're going to give access to the data.
Hey, John, I think we might have had a comment in the chat section. Okay. What if the data is anonymized in the cloud?
So often the vendors will say, yes, we will scrub the data so the data is not identified. It does not become PHI no longer. So if you're the seller, you've got to make sure you follow the law about what that means to make it scrub, that you've taken out the identifiable key fields from the data to make sure it's okay. Even with that, usually when I'm arguing for the University of Michigan, I still say to the vendor, you're not going to use the data for anything. You can't do anything with it. You can't market with it. You can't study with it. You can't do anything, because they usually want to say, hi, we looked at University of Michigan's data, and we see how they do this really badly, and we could tell you how to do this really great. And that's a PR problem with the data. So you've got to be upfront. It's usually if you're working with a large center sees that you're going to be using their data, they're going to put attorneys on the phone that are going to really want to know what's going to happen.
But what if it's built into consent? that the users consents that they allow us to use it.
And you're correct. That's where you have. That's what I'm saying. In the upfront, in your contract or your license or whatever, you're going to state you are consenting to let us use your data for marketing analysis or for quality initiatives. But by not saying it and leaving it nebulous and leaving it what they call silent in the contract, not talking about it, but then assuming it, that's when everyone gets into trouble later. Everyone, as a lawyer, it's when in doubt, spell it out. As a surgeon usually says, when in doubt, cut it out. But we're going to go with the legal side here. We're going to spell it out. Okay, let's move on. Now, if you're selling your stuff, especially to a healthcare center, medical school, or somewhere, they may be able to buy it. I don't know all the rules at all the different places, but they may not be able to buy it. And I'm talking about even on a mobile level. At this university, when people want to buy certain, we got to go out to competitive bid. You may be ready to answer it. You may be selling software that you think is the best idea, that no one's ever done it, and two other universities companies show up from California that have got something close, and you're in a bidding thing. The second thing is, skipping, you have to do that. Say you're just doing your mobile stuff. It may be a good idea to have your contract template or your form of acceptance or your form of license pre-done. Now, if you're selling to a big center, you also have to be prepared that they may say, we refuse to use your paperwork, and you're going to have to use our paperwork. And let me tell you, I do that here at the University of Michigan. I won't accept anyone else's paperwork. They start from ours, especially on the larger stuff, and they do it from scratch. And even on some smaller stuff, you have to be prepared to answer that kind of stuff. I think I'm okay. So let's do two more slides. So the next thing about selling software or giving software away, or even on these mobile apps, when you buy a house, you get a deed, or you buy a car, you get a title. When you give a license to software, you have a contract. There's no real title there. So what's put into the contract is an indemnification clause, in which that layman's terms is hold harmless. They want to know the software you're giving them or selling them or whatever, that you didn't steal it and you have the right to do this. Now, the thing is, if you're using open sources or you're combining stuff in, and if people don't do the due diligence, we've seen that. I've been in cases even for this place where we bought stuff and we were swept into the lawsuit because we were just the user of the software. So most places are going to require you indemnify them that if something goes wrong, that you didn't have clear title to sell that software or subscribe it or whatever, then you'll go to the lawsuit for us and we don't have to take care of it. So even for the most little companies, you have to do this. So that usually means you got to buy insurance to cover that, because it's going to cost, when the lawyers talk about bills, if it's under $200,000, that's just for cocktails, and the rest is, now we're talking real money. So you're going to have to give it. The next
John,
thing, yes.
let's talk about that for a minute, because I'm pretty sure you just scared every single entrepreneur in this room.
Right. I want to make sure I scared them a little bit so they understand they're going to. I've dealt with small applications of companies in Ann Arbor that were selling pharmaceutical apps and all kinds of stuff. And I said, they showed me the contract from the buyer, and the buyer said, I want 100% indemnification. These are other hospitals in Michigan. I said, you're going to have to give it. They want to know you didn't steal the software. They want to know you wrote it.
Here's my question. I just offered one of these app teams $10 million to go and take this to market. What's your sense of how much of that is actually going to be spent on development versus all of these other types of insurance, et cetera? Do you have a rule of thumb beyond the cocktail quote you just said?
Well, I guess it always depends on how badly you can get sued for what you're doing. So let's talk about you say the software wasn't clean and you had someone else's piece of software, so they sued, and depending on what they have, so is it a copyright suit? Do they have a patent on the software? If we're talking they have a patent, they probably paid $50,000 at least to get that patent. They're going to be suing you for $2 million. So usually the insurance policies, if you're selling to a big situation like a hospital like here, they're holding insurance usually at $2 million they call it, or $3 million. Now, if you're selling a mobile app that's just going to go on one-to-one, how much can they sue you for? It's each app. It's one small little thing. So your insurance levels lower. It's the thing is, you've got to verify that the software you're writing is all your own code, and if you use open source, you have good open source licenses to be allowed to sell it. And if you're combining with somebody else's code or software, you make sure those other people you're combining with have signed off that this combination is okay. So it's just a lot of due diligence. And Drew knows more about in the selling side how you verify all this kind of stuff, and I want to get into those weeds about all that. But you would still have to look at buying insurance. The other kind of indemnification, let's get off the software a second. Okay, we'll do this real quick, is if you're in the cloud and you're holding people's data under HIPAA, HIPAA doesn't require you give indemnification, but now more and more medical centers are saying, if you lose my data, you're going to indemnify me in case I get the fine because you did the bad act. And I've seen, depending again, the risk is how many records are you holding of that medical center? Is it 50 records or is it 2 million? When it's 2 million, guess what I asked for at U of M? Unlimited indemnification. That's a big insurance bill. If you're only holding 600 cases from radiology for a specific study, what's the worst implication? 600 cases? I have to send a letter to all the patients. I have to set up a help desk to answer questions. Maybe that's only a $300,000 insurance policy.
I think that's the key point too, John. It's kind of maybe just to kind of tie this out is kind of the dimensions that people need to think about as far as risk when it comes to the application. At least from your standpoint, when you're a buyer, you're thinking about risk, and the risk becomes a function of how much, the type of thing. You know, if you can spend a minute just kind of talking about how you guys look at that relative to the contract, what is risk and where are the places you're concerned?
Right. I'll give you a case example. I gave you the one with radiology I'm doing right now. It's a one workstation application. There's only 675 patients. They're offering us $2 million on insurance, which they're spreading against their other clients. That's probably going to be good enough that the worst we'd have is that. Now, someone says to me, no, we're doing a system where we want to put the whole portfolio of the U of M hospitals, 2 million patient records out there. I have to ask if the corporate board is going to ask for indemnification, it's going to be unlimited. It's just a scoping. It's also the level of the type of cases and how bad it is. You have to think of that. Are we studying OB-GYN and problem pregnancy birth problems? That's going to be scarier. Or is it AIDS patients where it's a very personal sort of thing? Or are we studying dermatology and its warts? I mean, who's going to sue? Oh, they disclosed my date, I had a wart. It's not a big deal. It's not going to ruin someone's career. We disclose their AIDS records or their OB-GYN records or something. It's just a different scope. Usually I do touch base with the physicians in the department, depending on who they are, so they have a feeling of how horrible it could be also before setting their risk. Now, is there a formula? No, this is Swami talk. We talk to risk management people, talk to lawyers, and you kind of figure out where you think you are and what danger you could be in. I think I'm running out of time, so I don't want to. We've done 30 minutes, or okay. More questions? Good. I'm writing the exam questions. We'll send them over soon. Thank you for your time. Thank you for having me.
Thanks, John.